Yesterday, Dr. Janelle Green Smith lost her life during childbirth, who's delivered over 200 babies herself, who is a midwife out of South Carolina. Why Black women are the most likely to pass away during childbirth, I have no earthly idea, but it is an exhausting number that continues to grow every single day. No matter all of the education, no matter all of the support, no matter how much advocating that she did for other people, in the midst of her giving birth to her own child, she loses her life. With everything that she did, with all that she gave, with all the continued education and support that she provided for other people, none of that actually protected her in the moment that she actually needed it, because she had provided it for so many people. I have already seen so many people writing and stating that they got through their pregnancy with her, and to even hear or even try to fathom hearing that this woman is no longer here while she was in the midst of giving birth to her child is absolutely devastating.
Hey y'all, my name is Janelle and I am a board certified nurse midwife. I'm going to tell you a little bit about my journey and what brought me to midwifery care. So I started my career in undergrad nursing. I graduated, I became a neurology nurse, hated it. And then I decided that women empowerment was my thing. So I transitioned over to high-risk labor and delivery, where I began seeing the systems in the hospital and how women are treated during pregnancy, labor, and birth. And I wanted to be the change. So I went back to midwifery school, and I got my master's degree in midwifery. I worked at a freestanding birth center for about 2 years, loved it, learned all things midwifery, and then I decided I want a little bit of another change. So I joined a hospital-based practice where I expanded my career, and I now do VBACs. I'm with a team that offers inductions of labor. We offer our patients epidurals, water births. So we have a plethora of options for birth and midwifery care. About a year ago, I got my doctorate in nursing, where I led a quality improvement project engaging the care for obesity in pregnancy. So a lot has gone into this degree and this field of midwifery, and I'm very passionate to share that with you guys. So comment below if you have any questions about my journey or general midwifery questions that I can answer for you.
Study, economists analyzed the medical records of more than 993,000 women who gave birth between 2008 and 2017. They found that even if a Black mother and a white mother with similar medical histories saw the same doctor at the same hospital, the Black mother was 20% more likely to have her baby via C-section. And while the authors of the study did offer some explanations, like differences in providers, physician demand, financial incentives, and more, there's a piece that I think was missing. And that has to do with clinical algorithms like the VBAC calculator and how we're taught to think about race in medicine. The VBAC calculator, or vaginal birth after a C-section, is a tool used by doctors to estimate an individual's chance of successfully having a vaginal birth after previously having a C-section. The algorithm, however, had a built-in factor that automatically subtracted points if you were African American or Hispanic. That made it less likely for these populations to be offered a vaginal birth and more likely to be offered a C-section. In some cases, selecting that you were African American or Hispanic changed your estimate of being able to successfully have a vaginal birth by up to 20%, as you can see here. It wasn't until 2021 that race was removed as a factor from the calculator. It now uses a more objective factor, previous treatment for hypertension or high blood pressure, as a metric. I think it's important to remember how in medicine, we've been taught to use race-based medicine like the VBAC calculator without even realizing it. We subconsciously and sometimes consciously use race as a classification for medical care. And if we're not conscious of that, it can impact the types of treatments that patients get simply because of the inherent biases that exist about racial groups.
So you're telling me a midwife, someone who literally helps deliver babies, died while giving birth? That doesn't even sound real. Because in your mind, you'd think, if anyone is going to make it through childbirth safely, it will definitely be her. And that's what's messing with me right now. This wasn't someone who didn't understand the risks. She lived in that world. She helped women come out of that world. So how does this still happen? I'm not even rushing past this because this is one of those stories you actually have to sit with. Imagine the number of women she helped, the number of times she probably said, "You're going to be okay." And then when it's her turn, she doesn't come back home. That's heavy. It's heavy because it doesn't make sense emotionally. But at the same time, it makes sense when you look at the bigger picture. If you're new here, subscribe, continue watching, because this is a story that needs to be put out there. It's not being put out there enough, and people need to put it out there enough. I don't think this is something people talk about it. We need to talk about this. And if I'm going to start this conversation in my platform, then so be it. You can start the conversation in the comment section. I need to hear you guys. I need to hear you speak about this story. I need you guys to channel this story out. Let's watch for American reactions, because this is a very crazy story.
Statistics show us time and time again that when Black professionals go into healthcare, Black physicians, Black healthcare workers, the patient outcome is better. All patients have better outcomes with Black healthcare professionals. And that's in regards to the patients reporting that they feel heard. That's in regards to the actual complications that may exist being caught sooner. And trust just improves in general within the healthcare system when there are Black physicians and Black healthcare providers. But I've always said this: what happens when those physicians and those healthcare providers need care for themselves? And I don't know if you guys know who Dr. Janelle Green-Smith is, but she is a certified nurse midwife, and she lost her life due to pregnancy-related complications with her first newborn child just a few days ago. And it's so heartbreaking and overwhelming. I tried recording this video, and I'm more so recording it because people on TikTok are not talking about it. I've seen this within my own medical professional space, and my colleagues have sent it to me, but I'm not seeing anybody talk about this on social media, particularly TikTok. And I just think it is such an important conversation to have, because representation in medicine, especially in women's health, absolutely matters. But representation is not enough when Black women are not listened to, when they are not believed, when they are not cared for, because the system that she was advocating for and the system that she was working in to change, to be that force, did not protect her when it was her time to receive care. And that is alarming. This is a tragedy, but this is also a warning, because if the person who's advocating for us cannot even survive this system, what does it say for the rest of us? And this is something that's not thought about enough. This is not something that's talked about enough. People aren't getting on here and questioning what happens when our advocates can't survive. We all look for an advocate, but when the advocate is now receiving care and that care fails her and she's not protected, what does that mean for the rest of us? What does that look like going forward? So representation is not enough. We need real change, whether that's laws that protect Black patients. We need change, because it shows us time and time again that regardless of a Black woman's education, her income status, her expertise, her professional expertise, none of it matters. None of it protects her from systemic racism, from medical racism. It's so deep in our system. The healthcare system is so flawed in the United States that no income level protects you from it. No education protects you from it. No expertise protects you from it. And this is alarming. It's scary. People need to talk about it more.
As an African-American nurse practitioner, not only have I seen the mistreatment of African-American patients, but I've experienced it myself. The voicelessness, the being unheard. And you would think that being educated and being an expert in the profession would allow you to be heard, but that's not the case. I've seen so many posts on this app with medical providers who kind of act like they're disgusted when people announce that they're in the medical profession. And this is the reason why. It has nothing to do with belittling you, putting you down as a health professional. It has everything to do with protecting ourselves. Because unfortunately, the education does not protect us from poor outcomes, because it's based on our skin color. We've seen it with the African American doctor who died during COVID and countless other scenarios.
I looked her up, and I really need you to go and see who this woman was and is. The comments from her patients who she cared for spoke volumes of her character, of her compassion, of her knowledge, of her strength. And although I never met her, I am devastated of the impact of her loss. not just her friends, her family, her coworkers, but the patients that she cares for. I don't know what happened, but I need you to understand that Black maternal mortality is real. It does not care who you are. It does not care what you know. It is real. And for Black women, going in to have a baby is one of the scariest things that they will do. So stop being offended if Black women don't trust you. Listen to what they want. Listen to what they need. And when they tell you something is wrong, something is wrong. My sincerest condolences to everyone who is impacted by her loss. And to Dr. Smith, thank you for the care that you provided your patients. And I hope that you're able to rest in knowing that there are so many out there that want to continue your work in helping people feel heard and safe.
Now, this is where it stopped being just a sad story and becomes something bigger. Because this is not an isolated situation. If you're a Black woman in the US, your chances of dying during childbirth or after childbirth are way higher than a white woman. Like multiple times higher. Do you get that? And I don't think people really sit with that. They don't understand the depth of that. Because when we talk about childbirth, we focus on the baby. We celebrate, we post pictures, we congratulate everyone, but we don't talk about the risks to the mother. There are so many risks the mother endures. So many risks. If you made it out of the hospital with your baby, you're healthy, well done, mama, you did it. And people always want a simple answer. Why is this happening? But it's not simple. It's layers, it's access to healthcare, how quickly complications are handled, what the doctors actually listen to you when you say there's a problem. And that last one, that one keeps coming back again and again. Women saying, I told them something was wrong and they didn't listen to me. That's scary. I'm not even gonna lie. As a mom, this is where it hits me. It hits me really, really hard. Because childbirth is already, it's a moment where you don't have control. You're in pain, you just want this pain to go away. And the only people who can make this happen are the ones who are supposed to deliver your baby safely. They're supposed to make sure you and your child are safe. You're trusting people. You're in a vulnerable state. You're in a state where I don't even know what state you're in, because at that time, all you can do is just pray to God. The 9 months, the 10 months that you have been growing a baby inside you, this is that one last minute where you're praying to God that you make it out alive, you make it out with your bundle of joy in your hands. And now imagine feeling like you may not be heard in that moment. Like you're paying your instincts. At that point, you have crazy instincts that tell you something is either right or something is terribly wrong. You know, we know this is happening. This is not new information. So the question becomes, why hasn't it been fixed yet? Why are we still talking about this? Why is childcare still being brought? Why is this topic still being talked about? It has been going on for so long. Black women are losing their lives to childbirth. Let's not even talk about their lives. Some women even lose their teeth. Some even lose their sight, their hearing. That's childbirth for you. Why are we still here? Why are we still talking about this? Because if most of these deaths can be prevented, oh my God. And to be fair, there are efforts being made, okay? Maybe. People are speaking up more. There are awareness campaigns. There are policies being pushed. Things like extending care after birth, training healthcare workers better. And that matters. That really matters. But at the same time, is it enough? Is it enough? Because if it were enough, we wouldn't be hearing of such stories of Janelle Smith. We wouldn't be hearing of such stories.
I want to just give all of the support and condolences to the family, because having done 300 births, clearly an amazing midwife, there is an excitement for your turn, right? This was her first child, and it just breaks my heart that she's not going to be able to be here to see her child grow up. And I feel like that is the concern for so many Black people, Black birthing people, is that we won't be here to see our kids get older.
The recent death of Dr. Janelle Green-Smith is devastating. The cause hasn't been released, and I want to be clear about that. But what we do know is that Black women are 2 to 3 times more likely to die from pregnancy-related causes in the United States. This lady was a trained midwife. She knew the system, and still this happened to her. This wasn't an individual failure. This is about a system that continues to fail Black women.
Dr. Janelle Green-Smith, a Black female, a midwife with a doctorate degree who fought tirelessly against the disparities that affected Black women. And that very thing that she fought for is what she unfortunately succumbed to, complications during childbirth. This just reminds us that these disparities still exist. Unfortunately, as Black women, it does not matter our degrees, does not matter our socioeconomic status. We are all susceptible, unfortunately. And this reminds us, as advocates, as patients, as care providers, we must work together to help bring about safer care for all, especially our Black women who are facing a very, very grave disparity.
Black women still die 3 to 5 times more often in childbirth than their white counterparts, even when you control for things like education and socioeconomic status, partner status, etc. And just today, I learned of the death of a beloved midwife in her community, a doctorally educated, certified nurse midwife, Janelle Green-Smith. This is yet another example of the way that a system that has racism built into us can harm even those of us who are educated, even in birth and pregnancy care. This is a woman who knew a great deal about labor and delivery. She had worked as a labor and delivery nurse. She knew about pregnancy care. She was a certified nurse midwife, apparently one of the best nurse midwives in her area. And you can see that she loved this baby and took very good care of herself. And yet it sounds as if she has died from what they're calling complications of childbirth. But we should talk about the fact that it really is complications of childbirth that happen because of systemic racism. And what does that mean? We could spend weeks and months talking about it, but basically it's a combination of systemic factors that go back generations, epigenetics that happen because of stressors that Black women's mothers experienced while they were in the womb, and then that changes the ways that their DNA is aged. It has to do with early life experiences that are built into the system, educational disparities, housing disparities, etc. But it also has to do with interpersonal interactions that happen during the index pregnancy where the person has a bad outcome, like microaggressions, like possibly getting less quality care, possibly not being listened to if they're bleeding more than they think is possible or more than they think is good. Maybe their head hurts and so they're dismissed and their preeclampsia is not caught as early as it could be, etc., etc.
One of the biggest things that they do that we do not do here in the United States is they don't blame the mother. They blame the system. Let me repeat that. A maternal death in any other country is not blamed on the mother. It's blamed on the system. How did the system fail this mother? She was supposed to spend this year being a mother, a new mother on top of that. Dr. Janelle Green-Smith, a nurse midwife, lost her life to birth complications. And again, we're back here having this conversation of maternal mortality in the United States. The United States of America has one of the highest maternal mortalities of any developed country. We are about 3 to 4 times higher than our neighbors above, and the number keeps growing. Dr. Janelle Green-Smith's death is an amplification of what we see in the data. What we see is African American Black mothers are 3 to 4 times higher risk of dying than white mothers.
And all this brings me back to a midwife. Someone who dedicated her life to helping mothers survive. And still, she didn't make it. So you can actually study this. You can study it for months and months and actually help women, and then you don't make it. This story is so uncomfortable. But maybe it's supposed to be uncomfortable, right? These are conversations that are supposed to make us feel uncomfortable. If it makes you uncomfortable, if it makes me uncomfortable, then it should be spoken about. Because if it makes you stop, if it makes you think, if it makes you appreciate mothers more, then at least something comes from it. May she rest in peace. May she rest in peace. And to every mother out there, you are doing something incredibly brave. Your body is doing something out of this world, extraordinary. You are fighting battles, silent battles. Mothers who are going through postpartum, mothers who are currently who lost their babies from childbirth. You did an amazing job, Mama. Mothers who have raised their kids and now all the kids are gone. You did it. Mothers who are still going through childbirth, this is their first time, they don't even know what labor pain feels like. You will know it. You will appreciate mothers more when it's your turn. But right now we're talking about this woman. This woman. Her name needs to be spoken about more. There may be dozens of stories about this because we don't talk about this more. We don't talk about this enough. There are so many risks that come from motherhood, from pregnancy. It doesn't just end when the baby comes out. There's tears, 4th degree, 3rd degree tears, the C-sections, you come across hernias, there's bleeding, there's fistulas. I mentioned losing your teeth, I mentioned losing your sight, your hearing, your memory becomes mushy. You might have been the most wisest woman in the world, and as soon as you give birth, you just become dumb. There's hormonal imbalance, and then let's not add postpartum depressions, mothers struggling. This is their first time, they don't have a community, they don't have a village. So yeah, motherhood is scary. When you see a mother, you need to hug that woman tightly because it is not easy. If you made it to the end, thank you. And as always, I'll see you in the next one.